I did my study on the epidemiology of dissociative identity disorder, known as DSM or 5-DUD. It is most commonly found when DSM cases is from 1 month to 12 months, and 5-DUD is a lifetime diagnosis of dissociative identity disorder. Some things that I found from my peer-reviewed study is that the most common gender that has the diagnosis is the male species, and it's usually white and Native American races. A diagnosis usually happens from when a major life crisis begins. Most commonly, it is associated with individuals with depression, personality disorders, panic disorders, and social phobias. Rarely, eating disorders are factors in obtaining a diagnosis of drug use disorder, and the study was done on 39 adults from 2012 to 2013, but the study was finalized in 2016 with all of the information gained. On the left is a graph of the phases of disassociation. Someone may be feeling disconnected from the world. They could feel like acting like a different person some of the time. They could have an inner struggle about their own self or identity, and there often can be memory loss or situations that they think that they're losing time faster than usual, and also feeling disconnected from your own body, mind, or self. To have a lifetime diagnosis, you have to have 2 or more of the 11 listed above. So something like a sedative, cannabis use, cocaine, heroin, hallucinogens, club drugs, ecstasy, inhalant use, and amphetamine. Why is this an issue? Well, a lifetime diagnosis is very serious for the well-being of the individual. There have been studies done to do it, but they are very limited. It is very specific in what the patient needs to do, what social groups they need to attend to, and of course they need to stay sober while dealing with this issue. It is very hard to collect individuals for a study like this because it is striking, and it is hard to go through the rehabilitation sequences and to progress from that. The morbidity rate of dissociative disorders diagnosis shows that 5% of the international population is affected by this. A diagnosis does not specifically lead to death, but outside factors definitely could. If someone is overusing the drugs that they are, it could easily mean to death. Why is this a problem, you may ask? To consider the studies that have been done, it is necessary that the patients need to follow the protocol and go to screenings. About half of the people in the United States who need help reject it. On the right is a graph taken from the Medical Association in 2016 from my peer-reviewed article, and it shows the male and females and the risk factors that they have taken, along with the ethnicity and races of them, the ages. It starts at 18, but it is easily a problem for children as well. It can start at the age of 12, the marital status, education, family incomes, if they live in an urban or rural area, and also the regions. Overall, the new intense research studies show how the outside relationships within one person's life connect to the bigger present-day economic and societal costs of long-term diagnosis of the issues above. Even though men are most susceptible to being diagnosed with a dissociative disorder, females are as well. It is important to connect with a healthcare professional if feeling ongoing symptoms of dissociative characteristics. I have